My name is Bob Penner. I'm with HomeFed Corporation, the developer of communities of Vizcaya and Cordovera in the Otay Ranch in South San Diego County. It is my great honor to introduce today's first panel, which is COVID-19 and business. I don't know about you, but when thinking about the panel, I'm reminded of just how many things have changed for us all in 2020. Last year, as chair of the South County DC, we hosted the summit live at the convention center. We weren't socially distanced, and in fact, we were actually encouraged to social distance, to be socially interactive. Today, we are meeting via the internet and unable to socially distance in the same way we used to. We are also asked to wear masks. And if I hadn't mentioned COVID-19, if I had mentioned COVID-19 last year, or even Zoom, likely none of us, with the possibility exceptions of our panelists, would have even known what we were talking about. Much has changed, and it has affected everyone and impacted almost everyone in every facet of our lives today. Today, we have a great panel assembled today to discuss the topic of COVID-19 in business. First off, we will have Dr. Hai Xiao, who is the medical director of hospital epidemiology and infection control for Sharp Chula Vista Medical Center and Scripps Mercy Chula Vista. Next, we'll have Diane Perez, a physician, a medical journalist, author, speaker, news anchor, and television host. Obviously a very busy person. Next, we'll have Dr. Craig Wajo, who is recently appointed Associate Chief Quality Officer for Scripps Health. And finally, we will have Barbara Jimenez, who has over 30 years of experience in planning, management, and delivery of social and human services. She will pull things together for us by discussing, among other things, what are the key steps a business should take when reopening. Now, let me introduce Dr. Hai Xiao. Hai Xiao is a board-certified specialist of infectious diseases, as I mentioned, medical director of hospital epidemiology and infection control of Sharp Chula Vista Medical Center and Scripps Mercy Chula Vista, chair of the Sharp Healthcare Infection Prevention Committee, and a key member of Sharp Healthcare Highly Infectious Disease Committee. Welcome, Doctor.
Thank you, Bob. Thank you, everyone, for inviting me. I'm very happy to share some of my thoughts today with all of you. Today, I realized that it's better for me to be talking like a doctor sitting in the doctor's office, face-to-face with every one of you, like doctors and patients, because that's what I'm most comfortable with, and that's what I've been trained about. I'm a board-certified infectious disease specialist. My job is to treat all the infections in the hospital settings, including bacterial, viral, fungal, parasites, you name it. Prior to the COVID-19, I've been predominantly involved in a lot of the treatment and policy management every year around this year, time of the year, in terms of flu season and everything. Since COVID-19 started in February, March in San Diego, I have been involved in a lot of aspects of how to deal with this new virus and gained a lot of knowledge and experience in terms of how to treat individual patient and how to manage a hospital as a whole, or our health system as a whole, in a lot of the policies. So today I realize I only have 5 minutes to share with you. So I think, again, it's better for me to act like your doctor that you're sitting across from you in a doctor's office and tell you something very specific about this virus, so that we can have some baseline knowledge established in order to help us to manage this virus, not only in a working environment, but also in a living environment like home. So coronavirus, as you all know, it's a respiratory virus. Just like influenza, it transmits predominantly through respiratory droplets when people cough, sneeze, or even breathe. Sometimes they disseminate this small particles in the ear and then transmit it through the distance. When people inhale, that's when they get infected. That's why today I believe it is another chance for me to emphasize how important it is to use certain method to minimize or decrease the chance of people getting infected. You probably have heard thousands of times, some people treat it very seriously, but some people may not necessarily get to the point that I would like them to do. So the first thing is masking. By now, you know that masking, lots of medical studies have shown that it is very important and effective in minimizing and preventing the transmission of the virus, because it serves as a barrier to prevent this respiratory droplets containing the virus to be disseminated in the air and get inhaled by the people around you. Study also shown that certain masks are much more effective than the other. For example, the N95s and medical masks, they can be preventing vast majority of the viral particles from penetrating through the barrier and getting into the ear. But some of the masks that you see in the general population, such as bandana, neck gaiters, and knitted mask, these are the things that studies shown over and over again. Not only they cannot prevent the virus from coming to you, but it also is a poor method for source control. A person who's infected, even wearing a mask like these, can still spread a lot of the infectious particles in the air and causing people to be infected around them. As a result, SHARP has adopted a policy recently during the screening of anybody coming to the hospital, whether like a patient or a visitor or volunteer or vendor. As soon as we find that the quality of the mask that you're wearing upon arrival is not as good, we offer to replace your mask with our medical procedure mask for free, as a most effective way of controlling the infection in a hospital environment. So I would encourage people not to wear those bandana, neck gaiters, and knitted masks. Instead, right now, multi-layered masks are widely available in grocery stores, Amazons, many places with relatively cheap price. I would encourage people, when you show up to your work, doing your business at work, wear a mask, but not just any mask. Wear a mask that truly is effective. That's my take-home message, number one, for today's delivering of message. Second is social distancing. Obviously, it's very important, needless to say, that we all know that after a certain distance, the respiratory particles, even if it's in the air, has much less chance of getting to your nose and mouth. So stay away from your colleague with a distance has been proven very, very effective in a working environment. One thing that we have found, that most vulnerable time doing work, when people are more prone to be infected, is when people gather together during the break time, sip coffee, sit down, chat, and eat lunch together. This is the time when people typically remove their masking. They have their mouths open, and they are relatively in close distance, and that's the time where people are most likely to be infected by their colleague, or infecting their colleague if they themselves are infected. Meeting is the same thing. We know that today, our president and first lady unfortunately got infected, but looking back at all the videotapes and everything, we found that they have a lot of the meetings where a close group of people are getting together with no mask on. So one person gets infected, the entire group gets infected. That's very unfortunate, and we pray for their health and everything. But that served as a bad example of working place infection control policy. If we do not wear a mask, nobody wear masks, nobody stay the distance, this is exactly what is going to happen. So I'm not at all surprised. To me, It's just a matter of time. So that's take-home message number 2, is that if you have to eat in a working environment, try your best to eat alone. Do not use this time to socialize, taking off your mask, get close to your colleague and start chit-chatting, because that's the most likely time you're going to infect somebody or get infected by your colleague. Take-home message number 3, obviously, is hand hygiene. We can hand hygiene and environmental hygiene, because the virus can land on the surface, and by touching them, obviously, people can get infected in a working environment. So if we have done all 3 of these, we pretty much have achieved most of the measures to minimize and prevent the transmission of the virus during the working environment. So with that, I'm going to pause, and I think I used my time, and thank you very much, and I'll be more than happy to answer questions later on.
Thank you, Dr. Sham. It's very informative. Next up, we have Dr. Diane Perez. Welcome. Diane is a physician, as I said, a physician, medical journalist, author, speaker, news anchor, and television host. Her programs have been part of Televista and Univision networks for over 25 years, airing in Mexico, the United States, and other Spanish-speaking parts of the world. She's a medical correspondent for the morning show Al Area, and I apologize if I mispronounced that, and the afternoon news show A Las Tres. She's a contributor of AARP in Espanol. Welcome.
Thank you very much, Bob, for this introduction, and thank you for this wonderful opportunity of sharing my main concerns regarding COVID-19 in San Diego County as a Hispanic medical journalist. I feel that in many aspects, there is a huge lack of information among the Hispanic community, especially among those who do not speak English or do not understand well English. And Latino community is definitely the most affected by COVID-19. 62% of the total of COVID-19 positive cases in San Diego County, and 48% of deaths are Hispanics. I think there needs to be a prevention campaign focused on the Hispanic community, not only for what is my main concern, our health, but also because of the important role of Latino workers, especially in South County's economy. Another point that I think needs to be addressed among Hispanics is the number of the underlying medical conditions, since most of the people who die from COVID-19, and the infectologist here can confirm it, is for those people who have either lung conditions, cancer, heart disease, or diabetes. These are chronic conditions, and diabetes is especially common among the Hispanic community. So I feel there is a need to provide more information and have more campaigns directed to the Hispanic community in Spanish. As Governor Newsom has been saying since the beginning of the pandemic and keeps reminding us, we are not out of the woods yet. So just on September 30th, 2 new community outbreaks were confirmed in San Diego County, one in a business and another in a restaurant. And we have to remember that the number of community outbreaks remain above the trigger of 7 or more in 7 days. So for those who are not completely familiar, community setting outbreak is defined as 3 or more COVID-19 cases in a setting and in people of different households over the past 14 years. And this must be of high concern. Private kindergarten and elementary schools are giving in-person courses, and that too is a risk of spreading the disease, since sometimes kids are sick without having fever or any other symptoms, and playgrounds are about to open tomorrow in San Diego. So one point that in my point of view also needs to be highlighted among the Hispanic community is the testing sites. As far as I know, the county has extended its total testing sites to 41 locations, but again, that needs to be communicated. People need to know where they can be tested, because first, people don't know they have to call, so they just show up, for example, at a CVS pharmacy. And there they are told that they can't stay in the building because they have symptoms and that they have to schedule an appointment online. But there's no availability when you go online to schedule an appointment on CVS. So people, and especially Hispanic people, do not know what to do in case they have symptoms. So that needs to be communicated in Spanish. Also, San Diego County is on the borderline of being pushed into the purple tier. So I think there is a need of having more campaigns directed to this community. Still, many people that are Hispanic in this part of the United States don't speak English, and they don't know that if they have symptoms, they have to call before showing up somewhere. So, and well, also, we need to communicate for the Hispanic community that there is a high risk of dying from cardiovascular events outside the hospitals. Many studies have published about this increase of mortality everywhere in the world outside hospitals due to cardiovascular events. So people need to know and understand that if they have these kind of symptoms, they can't wait. And hospitals have implemented the right measures to keep them safe and isolated from COVID-19 patients. So I feel as a Hispanic medical journalist that we need to do more in order to inform the Hispanic community regarding COVID-19, what they need to do to prevent, and what they have to do in case they are infected.
Very good message. Thank you, Dr. Perez. Next up, we have Dr. Craig Wajo. Craig is the most recently appointed Associate Chief Quality Officer for Scripps Health. He's actively involved with Scripps' response to COVID-19. Dr. Wajo previously helped lead system-wide responses to Ebola in 2014, measles in 2015, and hepatitis A in 2018. Craig, we welcome you. Oh, you need to unmute, Craig.
Sorry about that. Technologies. Thank you, everybody. Thanks, Bob. Thank you, everyone, for inviting me. Boy, what a time we're living in right now. And I just want to say thank you all for helping support the community and trying to get a handle of our current pandemic. You know, Scripps, beyond just being a healthcare system, obviously we're trying to take care of patients and help, obviously, with the pandemic in terms of the healthcare response. But we're a business as well, and I think there's certain things caveats that I can tell you what we did to try to implement processes and things to help protect our staff, and things that maybe are good takeaways for any business that, again, is just trying to deal with their own staff and caring for them. First off, you know, the role that you may have is in leaders in your business and the community is, one, just sort of educating your staff. I think the first thing we did at Scripps is we opened our what's called the command center. And, you know, if you're aware of Scripps, we have the 5 different hospital campuses and 40 or something different ambulatory facilities, 15,000 plus employees and volunteers and staff and physicians. Just to get the word out sometimes and getting the processes known is sometimes an ominous challenge. So by opening the command center, part of our disaster preparedness, it sort of allowed us to get the stakeholders in the room that were the leaders and allow us to get the correct messaging out to the right people and then disseminate that out. Again, a challenge to any of you all that have multiple locations. But again, if you don't do that, then I think our staff and your employees will not be prepared and not know exactly what to do, and if something were to occur in the sites. Once you sort of get that education piece out, then sometimes it's training. Like for us, we had to implement quite a bit of training that oftentimes changed frequently. and the PPEs, as everybody talked about, the difficulties sometimes of us getting the right PPE in the right place at the right time was tough. And so we had to message it, but then we had to train folks on the different types of PPEs. Even to get that PPE out to, for example, the right respirators, we had to train folks on how to get fit tested. Now we would normally do that, and we have done that for many other instances, but this was such a mass undertaking in such a short period of time that, again, the challenges were there on multifactorial reasons. Beyond the training and that sort of piece, one of the specific practices we wanted to try to implement was how do we protect our staff in sort of the day-to-day basis. And one factor that we did is we had a full review of who could work from home. And I think many of you folks probably did that as well. And many folks, as we're doing virtual meetings. And so all those things were implemented, again, to try to maintain the healthy workforce. We educated staff and folks to try to limit their exposures outside of the workplace, but obviously those are difficult asks oftentimes, but just having that education piece may make a difference. As Dr. Shah was saying, try to have some processes in place for where people can have their lunch breaks. Should they be eating lunch together? If they are, is it indoors? Is it outdoors? Those are some key points. Hand hygiene, how to stay healthy with the appropriate type of masks, as Dr. Shah was saying. And then if you are sick, what do you do? What symptoms might you be looking for? And should you stay home from work if you do have to go into work, or you are one of those workers that have to go in? We had a whole, what's called a decision tree we had to create because of the essential functions of many of our staff, that if they did, for example, get exposed or were sick, what do they do? And sometimes the healthcare workers are the ones that it will be the worst patients, if you've never heard that term before. But the healthcare workers sometimes will try to go into work because they feel dedicated to caring for their patients that are on their schedule, and then if they're feeling ill, they could potentially transmit. And so we were very strict in trying to make sure people stayed home from work. And then what did we do? Did we have to test? How do we test? There was all challenges that you're aware of about trying to see when we can test people, because there was limitations in supplies, reagents, and the swabs, and some of those things are still daunting tasks, but we had to implement those things. Once you implement those return to work strategies, the other things, can you have visitors in your workplace if you can close off your exposures from visitors? If you are going to have visitors, what's the process of screening folks? In fact, what's the process in screening your staff every day? That's something to that you should be all considering. This is something that we're hoping the vaccine will help, but as everybody has probably said in terms of the experts, WHO, CDC, and locally, this may be a challenge we're going to have to meet for a long time in coming. So these unique sort of challenges of trying to work in a different way is again something you really need to think carefully about and meet those head on. I think lastly, the point to make is there's environmental sort of controls and things that you might want to look at. We had to look at where people were working. We were looking at the ventilation system, which rooms are connected which, and we had to figure out, again, what the workflow would be. If some people were working, would they work with their coworker next to them? Is there plexiglass screens next between them? Some of those engineering controls were put in place. So I'll stop there, but I'm happy to take questions later.
Beautiful. Thank you so much. Appreciate it. Next up, we have Barbara Jimenez. As I mentioned earlier, Barbara has lots of experience in planning, management, and social delivery and human services. She currently is serving as the COVID-19 sector lead for cities government, and tribal nations. She also serves as the sector lead for binational affairs, assisting in cross-border and binational response for the County of San Diego. Welcome, Barbara.
Thank you so much. It's a pleasure to be here. Muy buenos días a todos. I'm going to shift what I was going to say a little bit just to kind of touch upon what all the other panelists spoke about. So I want to start with, we are very familiar with that blueprint for a safer economy, that tier-based system, and looking at those case rates and the test positivity and case rates. And so those are all details that are really important. It drives what we do. We're currently in tier 2, which is the red with that adjusted case rate. An important, really important piece there is that we spoke about a little bit this morning is the testing and the availability of testing. So when we look at those frameworks, we know that the state's going to be assessing these indicators weekly. The county needs to stay in that tier for at least 3 weeks before they're allowed to advance to a less restrictive tier. And a county can only move forward 1 tier at a time, even if the metrics qualify for a more advanced tier. The role that we all play as a community is really important. And everything that you heard from my co-panel members this morning is critical. Something I do want to touch upon in detail is, a new health equity metric is going to be taking effect on October 6th. And this is going to be in order to advance to a next less restrictive tier. Each county is going to need to meet an equity metric or demonstrate targeted investments to eliminate disparities in the COVID-19 transmission. And this is a little bit, or really drives a lot of the work that we have been doing. In particular, in South County, we have been just very fortunate to build upon those relationships and partnerships that the South County is really known for. It's businesses and schools coming together. It's our faith-based, and I just have to give a shout out to our leadership. Chairman Cox, Supervisor Cox, our mayors, many of the leaders in South County, that really we all recognize that the data was telling us that our Latinos, our Hispanics, our South County has been impacted tremendously. And so working together, really increasing the amount of testing sites that are available. We started out with appointment sites. We started out increasing sites. Now we are at primarily no appointment sites. We've been really innovative with the type of appointment sites that they're available. Specifically, I want to talk about the border testing. The testing we're doing at the U.S.-Mexico border in San Isidro at PED East is something that a lot of other jurisdictions have contacted us about, wondering how that is working. And we are seeing tremendous success there, as all the other sites. We have the drive up, the walk up. Yesterday, we announced, of course, the increase for the testing sites for our teachers in our schools as we're getting ready to go back. I completely agree that we all can continue to spread the word, especially in those communities that speak different languages, and really looking at it through that health equity lens is something that we're really proud to be able to partner with our community on and with our community partners. We also announced recently, the last couple of months, the partnership that we have with our particular entities in the community that have strong, deep connection to community throughout the entire county, and their ability to really get the word out. So these are community health workers, promotores, entities that are really working closely already in the Latino, African American, Asian Pacific Islander, and refugee populations, and helping to get that communication and outreach in the community and really leveraging those strong connections. And again, I think that's the key piece here, is leveraging those strong connections in the South County is something that is tremendously important. Can we continue to increase and enhance? Absolutely. And that's where I think we can all come together to do that. I do also want to note that for those of you who may not be aware, we have a very robust sector network within our coronavirus. And so we have a specific business sector that really focuses on telebriefings, webinars, newsletters, and touches upon everything that you heard this morning: PPE, what's required for a safe reopening plan, what if I'm uncertain about a certain guidance that's needed. And then going back to the original message by our first panelist, Doctor, just really focusing on the face coverings, sharing the messages on the face coverings, answering those questions about face coverings, making sure that we're really doing it in multiple languages and meeting our community where they need to be, talking about the social distancing. All of those key messages are absolutely important. So I'll end with just saying I'm really proud to be a South County resident for many years and to be able to work and serve this county. And so I look forward to any questions that you all may have. Thank you.
Thank you so much, Barbara. Well done. Appreciate it. We have a couple questions here in front of me that I kind of randomly ask each of you, if that's all right. Dr. Shao, as we're coming to fall and winter, there are concerns about the way I guess we behave, as how our behaviors are different as we approach the winter. Can you weigh in on, some of the different things that you see as a concern that we may have to change from what we've been doing, and if what should be our best approach?
Thank you, Bob. It's a very interesting topic. In fact, it's very tied up to our regular seasons of flu, how in addition with the COVID-19 this year, the entire pandemics would evolve. This is a very tough question to answer. Obviously, I don't have a crystal ball in front of me. Suffice to say, it's a double challenge because both viruses are respiratory viruses, and they infect almost the same organ system, and their symptoms are similar. From the hospital management point of view, we know that it added a different layer on top of COVID-19 for our diagnosis, treatment, and management. So with that being said, we are promoting from now people getting their regular flu vaccines in preparation for the coming season. There are two reasons for that. One, obviously, I already touched upon. You do not want to get infected by both viruses at the same time, because one virus can kill you. Adding another one obviously is not a good idea. So protecting yourself from one virus as soon as possible is always encouraged. We already have the flu vaccine widely available, so I would encourage everybody who's eligible for such taking the measures. Second is, interestingly, based on our newest literature, scientific data, our experiences with people who just experienced the cold winter season in Southern Hemisphere in Brazil, people found that those people who had been vaccinated with influenza vaccines, their rate of COVID-19 infection is lower compared to the other group. And even if they're infected, their severity of the illness and mortality rate are also lower. Now, we do not know what is the exact mechanism. Obviously, the influenza vaccine does not act directly on the COVID-19 virus because these are two different viruses. But the predominant popular hypothesis so far to explain this difference is that the flu vaccine may trigger or stimulate our innate immune system to prime our immune system to be more robust and protective, maybe, against other pathogens. So with that piece of information, it appears that indirectly getting your flu vaccine will help you not to be infected with COVID-19 or be less sick if you're infected. So with two reasons that I just talked about, as a clinician, prevention medicine is the best medicine. I would advocate everybody in a society now to get your flu vaccine as soon as you can for the above benefit.
Thank you very much. Well put. Dr. Perez, communications has been at the forefront of ensuring, people are protecting themselves and knowing what they can and cannot do. In your experience, how do we reach the portions of the population who do not have regular access to healthcare and resources?
That's a very difficult thing to do, I think, in my point of view, because when it comes to the Hispanic population, that's the one that I know the most. There you have two issues. You have the issue of the language, then that needs to be addressed. But you also have the problem of the undocumented persons who are scared to go to seek healthcare, because even if we have repeated in the media 1,000 times that there is no risk that they will be deported in case of going to seek healthcare because they have COVID-19 symptoms, they are scared. And that definitely needs to be addressed too. So I think there is a lot of need to communicate all that information and to communicate it with trustful people. I believe, as Barbara said, that these persons, these social workers that are doing a great job and definitely are absolutely needed, but maybe more campaigns in social media, because now social media has taken an incredible advantage over traditional media also, and over even the spreading the word with the social workers. So I think a campaign in social media could be of great benefit to spread the word that we need to communicate.
Makes sense. Thank you so much. Well put. Dr. Wajo, in a brief amount of time, I know in our office, whenever we come in, we get our temperatures taken. Is there anything else that we can be doing that's similar in speed and would have a similar effect in being able to tell? You need to unmute. Doctor, can you?
Sorry, why am I the only one with the mute problem? Okay. Sure, you can certainly screen folks for their symptoms, right? You can ask them if they're having fever or cough, any of those types of symptoms. And interestingly, the one symptom that I think many have heard about is the lack of smell or taste, which can be sort of subtle. But again, if you can ask some symptoms, screen them for that. Beyond that, it's like I mentioned it earlier, it can be very challenging to try to restrict travel or to try to determine what people are doing in terms of their non-work related hours. But if there's any way of screening folks from that end, I think that can be helpful too.
Thank you so much. Unfortunately, I had another number of questions, but we are out of time. I want to thank all of our panelists so much for today's presentations. It's such an important topic in our lives today, and the health of everyone. The last thing any of us would want to do would be harm someone else by making them sick as well. But at the same time, try and balance our need and desire to be productive. So with that said, thanks again. My greatest appreciation.
The San Diego Foundation is supporting our region through the San Diego COVID-19 Community Response Fund, helping local nonprofit organizations bridge economic, education, and digital gaps. Learn more at sdfoundation.org/COVID-19.